important topic. And what better day to give this talk rather than today? So no tobacco smoking day. We will be talking about smoking and its health risk. So thank you very much. So just like the introduction says, I'm Dr. Amaka Kate Uzu, and I'm a consultant family physician currently working at Bareen International Hospital. So I mean the first slide you can see does clearly show the cigarette smoking, and I just find this picture interesting because you can see people falling off the end of the cigarette, which just shows the harmful effect it can bring to the body. So we'll generally be covering a brief introduction on cigarette smoking statistics, just give us an idea of the numbers of the harm it does cause to our health in general, health risk, the benefit of quitting, and how we can quit smoking as well. So smoking, what does it contain really, the cigarette itself? It does have the nicotine side of it, and it's interesting to know that nicotine relatively is harmless to the body. But the problem with nicotine is that it is very, very addictive, and that's what makes people want to smoke often. But the interesting thing is that the clean form of nicotine is what is licensed to use to help people who want to stop smoking to stop smoking, and it has been proven to be very effective, where little dose or little level of the nicotine in a clean form, that means it has no extra toxic agents or carbon monoxide in it, would in a way and with time help reduce or stop people from smoking. Carbon monoxide, on the other hand, is a very poisonous gas. You can see from this picture here, just to give you an idea how much of that goes into the lungs when we're smoking cigarettes. And what it does is it replaces the oxygen, which is what our body and our lungs needs. And you can imagine having a lung filled with carbon monoxide gas. It does put a strain on the heart. The heart tends to work harder, and it also puts a strain on the lungs as well. So that's one of the agents that it is quite dangerous and causes harm to the body when we smoke. Then tar, you can see the picture of the tar, not very pleasant at all. It is a sticky brown agent which you can find in tobacco. And the way it works is it does cause staining of the teeth, staining of the fingers as well. It gives you like a yellow brownish stain, but also it sits along the vessels in the body. And what that does, it narrows the vessels and reduces blood flow, oxygen flow to different parts of the body, which includes the heart and the lungs as well. So when you think about the harm this can cause over time, that alone can make us realize that it can be very harmful to the body. Toxic chemicals as well, you can find in tobacco is the benzenes, the arsenic, and formaldehyde. These are all toxic to the body, as it clearly states, and should be avoided. So it's interesting to note that smoking is the biggest cause of preventable death and illness in the world. It does harm almost all organs in the body and can cause many diseases and also reduce our general health and well-being as well. So this slide is quite interesting. You know, it tells us that 8 million of people die prematurely from smoking every year. It's a huge number. And just to put it in context, you know, 1 in 5 will die in some countries. You know, so that just tells you how significant the death rate is with smoking. For reasons not very clear to us, men are more likely to smoke than women, and so that puts men more at risk of the health consequences as well as death resulting from smoking. So if you look at this, I'm not sure, I'm hoping this graph is clear to everyone, but there are 3 countries here. We've got the United Arab Emirates, which is, I'm not sure if you can see the color, but it's about purple in color, which is this one here, if I just highlight it. And we've got the United States and the United Kingdom. Interestingly, you would see the United Kingdom back in the 1990s has a very high smoking rate, and UAE we're not doing so bad if you compare with these 2 other countries. But over the decade, on the positive side, you can see that there's been a decline in the death rate, which is good news, and this is happening because generally people are starting to realize the harm smoking can cause in the body, and starting to either try to stop smoking or avoid the habit in the first place. So talks like this that we're giving today, general awareness to the public, publicizing it, letting people know the harm smoking can cause, is contributing to this reduction in the death rate. So that is in some way good news. Now we're going to talk about smoking and its health risk. I mean, if we go back to the previous slides, you probably have an idea that the lungs and the heart are one of the main areas that are being affected by smoking. But if we look at this picture here, looking on the right side where it says chronic diseases, you see the first one says stroke, and stroke basically means when there's a blockage in the vessels and that supplies oxygen to the brain, and that can occur if you think about the tar itself that is contained in the cigarette, causing narrowing of the vessel. So you can imagine the risk that can cause to developing stroke. The same for blindness as well. It narrows the vessels that lead to blood flow and oxygen or necessary nutrients to the eyes, and that causes blindness. Then gum infection, very, very common. There is also staining of the teeth. Some people lose their teeth as a result of that, and recurrent infections can occur. The aorta is one of the big vessels in the body, and it can lead to rupture, which is a very life-threatening condition and can be very dangerous as well. Heart diseases I'd mentioned earlier. So when there's narrowing of the blood vessels, that makes the heart work harder. And you can imagine where there's more carbon monoxide in the lungs. That also makes it difficult for the heart and the lungs to function. Pneumonia simply means chest infection. Yes, you can be prone to that with smoking. Hardening of the arteries, which I mentioned, where there's hardening and narrowing of the vessels, that does affect the heart and the general circulation of the body. Chronic lung diseases can occur. Examples of this, which some people might be aware of, is what they call chronic obstructive airway disease, or chronic bronchitis. And patients who have asthma, if you smoke, it does make your asthma exacerbations or flare up even worse. Smoking has also been noted to reduce fertility in some people, and it does weaken the bones. And when the bones are weak, that could lead to breakage as well. So on the left side of the slide, we can see in red, that's the cancer risk related to smoking. And you can see lots of organs can be affected. We'll start from the head and neck, where you have the throat, the vocal cord, the trachea, then the lungs as well. There could be cancer there, cancer of the blood, the stomach, kidney, the pancreas, the colon, bladder, and the cervix. So a large area of organs can be affected with cancer as a result of smoking. Then on the side here, I kind of indicated the pregnancy-related risk. So for patients who are pregnant or people who are pregnant and are smoking, does come with its own consequences as well. So things like miscarriages can occur, premature birth, where babies can be born early than expected. Then stillbirth or low birth weight can be expected for pregnant women who smoke. Just get onto my next slide. Yes, so I like this slide. It's funny, it's positive, and it also gives you a bit of an idea of the big change we can make if we decide to quit smoking. So, for example, it says in 20 minutes of stopping smoking, your blood pressure could reduce, get back to normal, depending on what the rates have been or the levels, the numbers have been while you were smoking. Then within 8 hours of stopping smoking, the carbon monoxide, which I mentioned earlier as a poisonous gas, would, it will be much less in the blood as well. Then 72 hours, you have the nicotine that I mentioned earlier as well, which is quite addictive, would have left your body in 3 days. And 2 weeks, all the circulation increases and continues for 10 or more weeks. And then between 3 to 9 months, symptoms like cough, wheezing, um, breathing problems, just general poor functioning of the lungs would improve in 3 to 9 months. And within a year, the risk of having a heart attack would have dropped by half. And in 5 years, the risk of stroke would return back to that of a person who does not smoke at all. Risk of lung cancer returns as well to that of those that don't smoke. And the risk of heart attack in 15 years will return back to just the general population for non-smokers. So overall, it does help us realize the significant and positive change we make to our health when we stop smoking. Okay. So now the next slide tells us how to quit smoking. So this is usually the struggle for most people. And first of all, just being mentally prepared for stopping is the beginning phase of it. And it does go a long way to see you through the phase of quitting. Some people choose to do it on their own without the help of any of these agents I've put here. It is possible to do that, but just it can be very difficult, and usually we find that you get positive response, or people actually stop smoking when they get extra support from either a healthcare provider or a health center, where you'll be guided, you'll be supported, and you'll be given the right medication that may be needed for you. So on this list here, there are a few options, and it all depends on your age. It depends on your preference, apologies, and also depends on if you're pregnant or if you have other underlying health conditions to be able to decide what method you can use to stop smoking. So I'll start with the nicotine replacement therapy, which what it does, it has low levels of nicotine, but in a clean form. You don't have that extra toxic agents or tar in it. And it comes in different forms. We've got the patches, we've got gums, inhalator, the lozenges, nasal and mouth spray. We usually advise patients to use a combination. It could be either the patch along with the gums. So we'll find that it is more effective that way. And what this does, it does help reduce the withdrawal symptoms some patients will have when they try to stop smoking, and also reduces the craving as well. Other forms are medications which are available. An example here is Zyban. And what it does, it helps work on the addictive part of our brain, and kind of, in a way helps us reduce that need to want to smoke cigarettes. Then the last one on the list here is e-cigarette, and I've got a picture of that. E-cigarettes are basically electronic devices that has low levels and clean forms of nicotine without the toxic agents, which you can vape as well. And so these have proven to be helpful for some patients to completely stop smoking. So just to summarize, from this slide, we can see the harm smoking does to our body, and it can also lead to deaths as well, poor health in general. So the key is think about quitting smoking. There are ways to do that. In the UAE, the Ministry of Health and Prevention, they've got clinics around the city of Abu Dhabi that offer smoking cessation sessions. And some of them are free, some of the services are free. And if you are keen and quite interested in stopping smoking, do reach out to your healthcare provider and we'll be able to point you in the right direction. It's important to know that quitting smoking is one of the important actions anyone can take to improve your health. And it doesn't matter how long you've been smoking for, what your age is. The key is to think about stopping, and you would notice a big change in your overall health. So thank you all so much for listening. Hopefully you've been able to learn a few things with this talk, and feel free to ask any questions you may have.
Hi team. Thanks a lot, Doctor. So if you have any question, please feel free to ask it to Doctor. So we'll start one by one. So if there is any question, please um, put it forward. Anyone online having any question? Yeah. Yes, Suma, please.
Doctor, thank you very much. It was really a very good session.
Suma, your voice, it's little like down. We can't hear it. The volume is down.
Okay, how about it now? It's better?
Yeah, now it is better.
Yes, I can hear her.
Nowadays, I don't smoke. I really don't like smokers also because my father passed away due to smoking. He had lung cancer.
Oh
But
dear, sorry to hear that.
but there's a new thing like, I have friends who tells me now I'm not smoking. I'm just vaping. Isn't the side effects the same?
Okay, so just to understand your question, so you're vaping, but you're
No,
not smoking.
I'm not. I'm not smoking or vaping.
Oh, okay.
I have friends who tells me that I'm not smoking, I'm just vaping. But
Okay.
isn't it the same?
Okay. Well, that's a very, very good question. And it can be quite confusing, to be honest. Vaping, like when I talked about the e-cigarettes are the electronic devices, and you inhale it by vaping, really. But what it has is the very low levels of nicotine in the clean form. However, if it's vaping, with that is not the e-cigarette, you find that some of them still have high content of nicotine and some other agents in them that are not very clear. So there are different types of vaping devices out there, and some may have some of the toxic agents and some may not. So vaping is not exactly the same as smoking cigarettes because the vaping has more of the nicotine itself. And remember, I said nicotine relatively is harmless, it's just addictive. But one has to be careful, what device you're vaping, just to be sure that it doesn't have the toxic agents like the carbon monoxide, the tars, and the other toxic chemicals in it. I hope that answers your question.
Yes, thank you.
Okay, and sorry, I don't think I mentioned about the side effects. So if it has the high nicotine content, the side effects, which comes mainly from the carbon monoxide and the tar, would be less because if it's only the nicotine, then you shouldn't have much of the side effects that you would get when you're smoking cigarettes.
Perfect. Thank you. T, you have the question. T. Hi, T.
Um,
Yeah. Oh,
I hope everybody can hear me. Doc, can you hear me properly?
Yes, I can.
All
Yes.
right. Good afternoon, Doc. Thanks for the awareness of smoking. I just wanted to ask, Doc, as a pure form of tobacco, like the rolling paper or smoking through a pipe, uh, have similar side effects or health risks as a cigarette?
Okay, so just to clarify, your question is the different forms of smoking cigarette, right? As opposed to the cigarette, you mean the rolling?
Yeah, so a pure form of tobacco that normally is handpicked from different farms, and
Yes.
you can roll it and smoke it, or you can use a
Yeah.
smoking pipe as opposed to the cigarette that has those chemicals that you mentioned earlier on.
Well, I mean, the raw form I would expect, or it should have the nicotine as well as the tar in it. Is it because I don't know about it just being only nicotine. You know, if it's the tobacco itself, which would have the nicotine, the carbon monoxide and the tar, then yes, it will give you a similar side effect as the as smoking the cigarette.
Okay. Thank you, Doc.
You're welcome.
Thank you, T. Um, Doctor, I have a question from one of the colleague. So he's trying to get cut down the smoking, like cut down the number of cigarette he's right now consuming. So he want to know, like, is there any better way or any type of practice that he can do where he can, come down and there will be a point eventually he will not be smoking. So I believe he's not taking any medical help at the moment, so he's trying by himself. So this was his question.
Okay. It is possible to try without any help, but it is quite difficult. I mean, we recommend that you seek help from your healthcare provider when you want to stop smoking. And the reason being, because you go through the craving phase, you go through the withdrawal symptoms, and some of them can be very challenging to one's health, and it makes you relapse because of those withdrawal symptoms we get. So I would encourage him to speak to his healthcare provider, and we can go through the process with him. I mean, because you have to kind of slowly come off cigarette smoking. You need to have a date in mind that you want to completely quit, knowing that that date you decide to stop, there will be withdrawal symptoms, and you need to be able to know how to cope with that. So really, doing this with the help of your healthcare provider will make it a better transition. There is the counseling process that is involved as well. So it's not easy to do it on your own. It is doable, but it is difficult. So I would encourage him to speak to his healthcare provider and they'll be able to advise him. And he doesn't necessarily need to use any of the agent that has been mentioned, but at least he has some kind of guidance as well through the process.
Thank you, Doctor. Doctor, there's one more question, is on the passive smoker. So if there are kids or anyone who is not smoking, however, they are getting exposed to one who is smoking, how
Mm.
harmful that would be, and and is it like that harmful, or how would that be?
Okay, well, that's a very good question, passive smoking. It does have its side effects. And some people may not realize that the fact that one is not smoking, but you're inhaling the agent from someone next to you or in the same building or in the same room, you could have problems, especially for young kids. They could be prone to having recurrent coughs and colds or chest infections. And also, people who have asthma, even if they're not smoking but have people around them smoking, makes it difficult for their asthma to be well controlled. It actually makes it worse, and they find themselves having flare ups quite often. In children, it has led to what they call cot death in some cases, especially for very young babies. Sometimes ear infections, which can lead to what they call the glue ear because of recurrent ear infections, has been found for babies who their parents or people around them smoke. So it does have its negative effect, and the key is probably avoiding being around people who smoke. Even if you don't smoke, you could be also getting the bad effect or side effects from being around such people.
Thank you, Doctor. Anisha, you can ask the question. You're on mute, Anisha.
Yeah, yeah, yeah. Hi, doctor.
Hello.
Doctor, I don't know if I've missed out on any question or answer. Just wanted to check
Okay.
smoking shisha or, is it harmful as the cigarette also sometimes, or it's really not?
Well, I'll be honest with you, I'm not aware of the content of shisha, to be honest. So I really don't
Okay.
know the answer to that. It's not something I've looked into.
Okay.
I don't expect it will be 100% safe, but I can't tell you for sure data's around shisha.
Okay. Okay. Fine.
Yeah.
Thank you.
Perfect. Any more question from the people online? No. So I believe, thank you, Lok. I think we can wind up the session. It was indeed a very informative session, and like you have precisely put in your slide, one of the smoking is one of the cause of preventable death. So we believe this message will reach us to everyone, and some of them will pledge in today quit smoking, and we will support and we will encourage that goes in that direction. Thanks a lot for your time and the Bareen team. I would like to thank John and Rinsu for having this session, and we look forward, Doctor, for for future sessions with you and the Bareen team as well. Thanks a lot for your time. Thank you, team. Thanks a lot. Thanks all for joining us today.
Okay. Thanks everyone for listening to this talk, and thank you very much. And we'll be happy to help in future talks.
Thank you.
Okay, take care, everyone.